Compulsions, the syndrome. Obsessive-compulsive disorders which although must be found but be nevertheless performed when tormenting, although they almost always exaggerated or are absolutely senseless, are emotional disturbances at which the patient stands under the inner impulse to carry out certain actions or certain things to think. The persons affected recognize this senselessness in most cases, however, cannot disregard it. The two most frequent manifestations of compulsions are compulsive acts and coercive thoughts. Both can be emitted so strongly that they make a normal life impossible. According to estimates, around 1 million people are affected by this emotional illness in Germany. Behaviors are these. Compulsive acts must be repeated by the patient, a ritual at once, permanently, around the fears of soothing or preventing that an accident happens to him. After explaining the action, feels the fallen ill for a short time, relieves oneself. Typical examples are the obsession with washing, the control compulsion, and the order compulsion. Coercive thoughts, however, are obtrusive ideas, impulses or ideas which torment the person affected, recur continually and cannot be replaced despite effort of will. The thoughts of the patients revolve around aggressive, sexual or violent topics which they find repulsive at the same time, since they usually violate social taboos. The therapy. At the treatment of obsessive-compulsive disorders, the cognitive behavior therapy has itself is pointed out very effectively. At first, the exact analysis of the compulsions of the person affected, compulsive acts and or coercive thoughts, as well as the clarification, is in the center of this therapy. Why the disturbance has developed at all. You support on this knowledge started with that to develop sensible and compulsion-liberal behaviors which replace the compulsions. The patients go in the context of a so-called outline training, at first in the company of a therapist, specific into compulsion-triggering situations, without reacting to it with their rituals. By the successful mastering of such exercises, the person's affected self-confidence is strengthened little by little, and the training can be continued also without a therapeutical company. After a certain time, the patient wins quality of life back step by step. A medicinal therapy is very advisable supplementarily to the behavior therapy and can reduce the symptoms of an obsessive-compulsive disorder considerably.